Yeah, the best part is, and I've said this at least 10 times to docs during this retreat, it's the platform. It's very unique to have a platform like this where you have so many doctors, so many resources that are willing to help at the, instantly. I've been a part of other groups and I've worked in many places and I've had great experiences with other people and other providers and other groups. I think what makes SPG different is just the fact that we are all very collaborative, that there's already a step-by-step to success that we get to follow, that we get to reach out to as far as questions go, as far as concerns go, as far as, hey, what did you do in X, Y, and Z in this situation? Maybe you're having trouble, a complication happens, which is going to happen to all of us eventually. It's in medicine, things can happen, but you're not on an island by yourself. You have people to reach out to who want to help you, not just can help you, they want to help you. And that we all want to see SPG do well, specifically to take care of people, So I think those things, I went on a little tangent, but I think the biggest things is that we're part of a platform of people who want to help each other, number one. And then number two, that goes with that, it's just you're not alone. You're just not alone, and that you have people who want to help you at any given time.
Perfect.
Yeah, I'd say the implant confident dentists are the ones who have done the research. They've been doing it and when I say doing surgery, practicing dentistry, maybe for a little bit, maybe longer than others, maybe shorter than others, but they know that they've done their homework. They know that they've done the courses. They know that they've studied, our online SPG universe. They have mentors. They're vocal. They reach out to people, and they're ready. Even if they don't have as many reps as somebody else, they've done their homework. And not only that, they're confident in their ability to execute that work. It's one thing to learn everything, it's another thing to do it. So they kind of have a good balance between preparation for whatever surgery it is, treatment planning, whatever it is, but they also have the confidence to be able to execute it. And I think that separates them from the ones who are a little bit implant hesitant, because they might not have that second piece, or the first piece really. And if they don't have the first piece, then that's good. Please be hesitant, until you have that first part down. But I think the ones who are truly hesitant are the ones who, have the background for it, but they maybe just don't have that confidence to implement the care that they know that they're ready for. So how you get better at it, just see the person in front of you as a human. Don't see them as an arch. Don't see them as 4 implants that you have to place in the jaw. See them as a human. See them as your mom, your brother, your sister. How would you communicate to a family member about what you are about to do to them? And what's to be expected afterwards, What are the things that we need to talk about? What are the things that we don't necessarily need to go in depth about? So to answer your question about how do you ease somebody maybe who's nervous or anxious, things like that, addressing it, I think number one, like, hey, Miss Jones, asking the question straight up, is there anything that makes you nervous or scared about this? Many times it's, doc, I know it's gonna hurt really bad. I'm scared I'm not gonna like my teeth. I'm scared that, I'm too old, all these different things. And just addressing them one by one, before we get started. Hey, Ms. Jones, that's a very valid concern. Number one, you're not the first person to go through this, but it's still a valid concern. And just I won't answer everything one by one, but just kind of going through, just being transparent about everything and ending everything with hope, because everybody wants to get to this place. They might be scared of the in-between, but we need to put the spotlight on as the hope that, hey, we're gonna get here. There's gonna be some roadblocks, but at the end of the day, if we keep the focus here and address all the potential roadblocks that they're concerned about, I think that can ease people up a little bit. Yeah, I'd say treatment planning, number one. You have to know where you're going. Nobody wants implants, everybody wants teeth, right? They want a smile that they're confident with. They want a smile that they can chew with, function with. So you always have to start with the end in mind, and that starts with treatment planning. From the day that you see the patient's x-rays, to their smile design, to seeing how their teeth align with each other, to see where they need to be. I'd say surgery, obviously, just taking out teeth. We need to know how to do that efficiently, how to do that most minimally invasive as possible. how to preserve bone when we need to preserve it, how to remove it when we need to, how to manage the soft tissue, gums, all that good stuff. And then lastly, this might be overlooked, but I think just the soft skills. You got to be able to talk to somebody and present yourself as somebody who's, that you would want your mom treating, or want your mom treated by. You have to have those soft skills because somebody's trusting you not only with a lot of money, but really with their health. So you have to be able to talk to them in a way that says, hey, I got you, and I'm with you. Yeah, I think it comes from a good place most of the time. I think it comes from a place of wanting to be perfect, of wanting to be excellent, which those are great things. Yes, strive for perfection, strive for excellence. But kind of what we were talking about earlier, you can't be scared of failure. I mean, not just dentistry, literally anything. When is fear of failure gonna help you, right? There can be an awareness of failure, an awareness of complication, an awareness of things. But just to have like this crippling fear, like that never helps anybody. But just like with patients, addressing that fear, maybe it is somebody's, first time to be in a situation with a complication or whatever the case may be. You have two options. Number one, lay down and quit and, just let your fear win. Or number two, try to figure out what's going on and move forward. So I think it comes down to as simple as that. It's pick your hard. They're both hard. Quitting is hard. Keep on moving forward is hard. So I think when a doc may be kind of nervous or in a situation that they've never been in, pick your hard. Quit or move forward and learn from it. Do something that maybe you in 5 years is gonna look back on that day and say, hey, I learned something. Hey, I'm proud of myself for pushing forward. Hey, I'm glad I was able to take care of the patient still, even though it was uncomfortable. So I guess just choosing your heart and just knowing that life goes on, and that your patient needs you in that moment. Even if you're uncomfortable, your patient needs you. I think printing is kind of taken over a lot of industries, specifically with dentistry. Just that we can print materials that not only are going to be temporary, which a lot of times right now, a lot of those materials are temporary, very good quality temporary materials. But I think in 5 years, maybe longer, I can't really put a date on it, but I think you're going to start seeing longer term printed materials. It's a little bit more of an efficient workflow, not only for the provider, but also for the manufacturers, and for the patient too. It just makes things a little simpler. Right now, those final materials, for the most part, are being milled.